So the question is what is a rhinoplasty? Rhinoplasty is basically nose reshaping. Oftentimes I'm asked about what the best way for my nose to look, and of all the surgeries I do, it's the most artistic of all. And rhinoplasty, sometimes in some patients who don't want a huge change and want to just look like themselves but a better nose, you just end up refining their nose, removing the deformities associated with their nose. There's typically a dorsal hump, a bump on their nose, or a bulbous tip, under projecting nose, over projecting nose. Those are the things that are the most straightforward and easy rhinoplasties. A crooked nose is a little harder, but those are the things that, like, for some people that's all they want, and that's kind of your basic rhinoplasty. But as an art form, and it takes years and years to master it, you have to have done hundreds and hundreds of noses to be an excellent rhinoplasty surgeon. It's a lifelong commitment, and I've committed to that. And so the issue is there are some noses that really require a whole rearranging of the bony and cartilaginous structures, and there's about 18 to 20 maneuvers that you can do to change the nose, and you have to be well versed in all of those type of maneuvers and comfortable with those maneuvers to get your best result. And not every nose is the same, and not every outcome is the same. The skin quality is different, the bone's different, and then what the patient wants out of their nose. And so as a rhinoplasty, an experienced rhinoplasty surgeon, that's really important to be able to do that so that you get the best result. You really want your most experienced surgeon doing it so you get one rhinoplasty done right. I do so many revisionary rhinoplasties, and those rhinoplasties, oftentimes you can just tell that they weren't done by professionals, by a master, by someone who really understood rhinoplasty. And so they have some what I call half-assing, some removal of cartilage here and there, but they don't do a comprehensive nose. And sometimes I find that I'm either doing a completion rhinoplasty, just finishing what they didn't finish, or having the confidence to take the hump down more so than what they had done, or give it some more structure. And those are the kinds of things that revisionary rhinoplasty, you don't want to go into a rhinoplasty thinking you may have to have a revision. So the question is what are the maneuvers? What type of things do you do in a rhinoplasty? Obviously the most common is a dorsal hump, a hump on a nose. That's the most common. Oftentimes, I would say that's probably the most common, where we shave down the bone and then we shave down the cartilage. Oftentimes that can be associated with an under-projecting tip. And an under-projecting tip is the tip that doesn't match. Even when you bring the dorsum down, the tip is still under-projecting. And sometimes we can elevate the tip by use of suturing or cartilage grafts. The next is bulbous tip. A bulbous tip is just a bulky looking nose, a wide tip, and that can be improved again by suturing and or grafts. And the final determination of those and how it looks is real time in surgery. And a lot of rhinoplasty is artistic in rasping a little bit more, tightening a little more. Maybe I'm going to try a tip graft, place a tip graft on, see how that looks. It really comes down to the art of your surgeon. Okay, so then we have other types of noses. We have over projecting tips, where we have to take the tip down. We have to pull the tip in by dividing the cartilages and suturing those together to shorten the tip of the nose. Some people have a drooping tip, which is pretty common, and you really want to shorten the nose, and so sometimes we have to shorten the nose. Those are the most common. Occasionally we get crooked noses, and the crooked noses are pretty tough. We have to open up the nose, we have to remove the spring of the septal cartilage and put basically braces on each side of the cartilage called spreader grafts to straighten the nose. And that's a very important aspect of nose straightening. And I think a lot of surgeons don't really get that and understand that really to fix a crooked nose takes a very specific type of maneuver. And as I mentioned before, there's about 18 to 20 of these type of maneuvers that you have to be really well versed in order to create an artistic, attractive, beautiful nose. So one of the questions I get is what happens if I have really a prominent nostril, or what they call also a hanging columella. The part of the central part of the nose sometimes looks drooping. That's part of the comprehensive rhinoplasty, which we see very commonly. Oftentimes we'll shorten the columella, this part of the nose that you see, and there's maneuvers which are called caudal septal excision. That's the doctor term for just removing about 2 or 3 millimeters of the bottom of the septum. That raises up the columella. The next maneuver sometimes is lowering the alar rim, so the rim right here sometimes can arch up and be very prominent, and you can see your nostrils. And so a lot of times we'll place a alar contour graft, which is again a doctor term for just placing a matchstick piece of cartilage just along the rim to straighten that. Sometimes I have to go to the next level, and that next level is if the columella still is bowing down too much like that, I'll actually divide the cartilage in half and then suture it together, sometimes over a strut graft that I get from septum. And I know I'm talking technically, these are things that I do, but each portion of the nose has its few maneuvers that I can change, and you have to have the confidence and you have to have done hundreds to be able to confidently improve those areas. And so, but they are very improvable. In other words, the hanging columella, the prominent nostril, those are fixable, very much so, but you have to have experience in doing this. So I've been asked many times how to prepare for rhinoplasty surgery. There's no specific things for rhinoplasty that you need to prepare. I would, obviously avoid aspirin or any non-steroidal anti-inflammatory medications. I tell everybody globally, if you do cardio prior to surgery, you're going to recover much quicker. Even 2 weeks of doing cardio, a half hour, getting your heart rate up, this real cardio, I mean like sweating cardio, makes a big difference in your overall post-operative recovery. But other than that, there's no other real major issues you need to deal with prior to your rhinoplasty. I've been asked what to expect on the day of surgery for rhinoplasty, and what I like to do is I like to meet with the patient, rediscuss their goals and what they want their nose to look like. At that time they meet with the anesthesiologist, because we do put people to sleep for rhinoplasty surgery. Typically a rhinoplasty surgery is about 1.5 hours to 2 hours long. They really, in today's world, they don't have a lot of pain or discomfort after surgery. They will have some packing which will come out the next day. Usually we operate on rhinoplasty patients on Tuesdays and Wednesdays, so that the following Monday, which is a clinic day for me, I can take off the splint and take off the sutures. By then their nose looks pretty good, and usually they have a little bit of bruising, and other than that, most people by 8-9 days really look quite good with a little makeup. A question I was asked is, after rhinoplasty, are there any post-procedure adjustments or things that you need to have done? And yes, rhinoplasty is an art form, but a lot of times the skin envelope wants to go back to the old skin. It has memory. And so it's not uncommon in thick skin individuals for me to put steroids in their super tip area, maybe a month or 2 months out. Sometimes we need to build up a little area. That's part of rhinoplasty. And the more and longer I've been doing rhinoplasty surgery, the more I realize that the post-operative care is just as important as the surgery itself. I've been asked, what is a non-surgical rhinoplasty? And sometimes there are patients who've had previous rhinoplasties or not, that a simple filler can make a big difference in the appearance of the nose. If their nose is too scooped out, if they have a certain bump. And sometimes you can just use fillers around the nose to expand the skin envelope, and it can make the nose look better. I oftentimes can use a non-surgical rhinoplasty after rhinoplasty to go from good to great, or sometimes some people don't even need a rhinoplasty and all they need is a little bit of filler. So that's when you're talking non-surgical rhinoplasty, you're talking about a filler using something like Juvederm, or I even use silicone oil, which works really well in the nose. And so that's it on that.